think we all should be proud to be in West Michigan. We are really part of what's called the West Michigan COVID-19 Vaccine Collaborative. What that means is, we're coming together as Spectrum Health, as Metro Health, as Mercy, Kent County, Ottawa County. We have universities and schools, so Grand Valley, Michigan State, Calvin College, our independent provider organizations, Answer Health and We Are for Children. We're kind of, removing our badges in our, the Block M or the Spectrum Health badge. And what we're doing is we're coming together for the betterment of our community. We certainly learned a lot during the H1N1 pandemic, and we learned that we were kind of tripping over each other as health systems and as health departments. And so could we do this better this time? Especially now with the vaccine being here, and it certainly is exciting that the vaccine is here. There's that light at the end of the tunnel. We want to make sure that we're doing it correctly, that we have solid communication coming from all of us as health organizations or health departments, so that we don't confuse the population. And then there's a lot of logistical things, right? Dr. London talked about the storage and the deep freeze that you need for these vaccines. Well, we have to kind of work on what does that mean? When can we give the vaccine? How long does the patient have to wait till, after they get the vaccine, like waiting either in the parking lot or in our offices to make sure they don't have a reaction? All those little details we are coming together and working on, again, as a community.
Well, I really think for at least those simple things like masking and social distancing, I think we should be thinking about that herd immunity level of 65 to 70% of the population. Now, I think we can get there pretty quickly, assuming that we have supply of vaccine available and assuming that we have a population that's willing to be vaccinated.
This vaccine is government allocated, meaning you as local businesses and employers really don't have control over when you can get it in your hands or when your employees can receive it. Okay, so what do we know today about whether we can mandate the vaccine? Well, there's a handful of considerations that I want to point out to you. The first is the Americans with Disabilities Act in Title VII does allow for certain exemptions for employees. Examples of statements that employees have made in real cases for which courts have approved religious exemptions are: our bodies are a temple and God gave us dominion over our bodies. Injecting the flu vaccine into my body is morally wrong. Or followers of my religion are healed by plants, fruits, and grains. So you guys get the idea. Quite frankly, what this means for all of you is that your clever employees will be able to go online and probably figure out what they need to say in order to get and request, I should say, in order to request an exemption based on religious grounds. So be prepared for that. And again, I would recommend you have thought through what sort of written process you want in place, who is going to evaluate those requests, and how you're going to be making those decisions. Also think about what it means then if an employee gets an exemption based on religion. How are you otherwise going to accommodate their belief so that perhaps they can remain at work, and or will you be giving them a leave of absence if not?